This post is supposed to be about autoimmune diseases being suppressed, immune suppressed, and dealing with sepsis at the same time. What many of you know, if you follow me on Twitter or if you follow me on Instagram or Facebook, is that for the past few weeks, I've been struggling with my health. You may ask how I've been struggling, and the answer is pretty simple. My first post talked a little bit about Neuromyelitis optica, which is the disease that I was diagnosed with. Because I was diagnosed with Neuromyelitis optica, I started on the treatment that is usually used in many of our cases, which is called rituximab, which is a type of chemo. It's a chimeric agent. And I also went on another chemo type immunosuppressant called Imuran. Because I was on so many different medications, I was on the rituximab, which is an immune suppressant, the Imuran, which was an immune suppressant, but I was also on steroids, which in and of itself is another immune suppressant, and I was getting plasmapheresis, which means I was, at the time, quadruple suppressed. What did this do to my body? Basically, it caused my immune system to shut down completely. No immune system. How could one function, one might ask? Well, you can still function perfectly fine. You're just like anybody else, except you have no immune system. So what did this mean for me? I literally got sick, very sick. We don't know how or where it came from, but my first round, I became septic. I was admitted to the hospital, and they started treating me and testing me to try and figure out what was going on, because I was running 103 temperature. I was throwing up. I was shaking. I had the chills. I was downright miserable. I was pretty sure I was dying, and I could have. I was septic with salmonella. Salmonella. Where did I get that? You can get it from picking up an apple in the grocery store, from eating something. You can get it from your water. You can get it from eating sushi. You can get it from eating raw meat. I had no idea where I got it. On the 4th of July, I had hamburgers that were pink in the middle. Not my fault. My uncle did it. For my birthday on June 30th, I had sushi. I love sushi. I could have got it from that. I could have got it from drinking my well water. But because I was so immune suppressed, I couldn't fight it off like normal people. Someone else that is not immune suppressed would maybe get the diarrhea, throw up for a day or two, and their body would fight it off and they'd go on their merry way. Me, on the other hand, I don't think so. What happened to me? I ended up in the hospital. I went from my plasmapheresis treatment, where I was running 103 fever and vomiting, down to the emergency room. From the emergency room, I went up to another floor where I was put in quarantine until they could figure out what was going on. Because I was on Imuran, my blood work was coming back normal. How do you even get that? Normal blood work. Thank God they ran blood cultures and grew them, and it grew into a bacteria. That bacteria was salmonella. It was in my blood. Not only was it in my blood, the port that I once had, the permacath that I had, you might have noticed it in my last video, I think, they had to be removed. Surgery, fun? No, not really. So I had to have surgery. Those had to be removed. I had to have another line put in. Fun? Seriously, though, it was not something I'd ever want to experience it again. And I experienced it 3 times. Once at Conemaugh, where they took me in, they treated me. I was in for about 2 weeks. I think it was about 2 weeks. I had IV antibiotics. I had, let's see, what did I have? I had a bronchoscopy where they shoved a tube down my throat into my lungs. Yeah. I also had pneumonia. So I had pneumonia. I was septic. It was not fun. They thought that they cleared me up. They sent me home. A few days later, I had an appointment with a doctor in Pittsburgh with the Gastroenterology Center. I get down there. Of course, I didn't feel very well. I had the diarrhea so bad, my dad had to stop over and over again so that I could get out of the car and run to the restroom. I didn't always make it. I had to wear diapers. I'm a 31-year-old woman. Who wants to wear diapers when you're 31? But as a side note, ladies out there, if you're looking for a good pair of diapers that don't feel like diapers, try the brand Depend silhouettes. They're just like underwear, feel very comfortable. You don't even realize that you're wearing them. That is what I recommend. Buy those. So we get into Pittsburgh and we are stopped in about a 3-lane highway, and across the road there is a Panera Bread. Well, we're in the lane over here. Panera Bread is over here. I have to go to the bathroom. There's no way to get there. What do? I hop out of the car. I run across the highway, and I get myself into the restroom. Not fast enough. It was so embarrassing. I didn't know what was going on. All I know is that I had to clean myself up, clean up the floor, clean up the toilet. It was just a disaster. And I was utterly embarrassed because there were other people in the restroom, and I'm there apologizing and crying and bawling and praying my dad could somehow figure out how to get back to Panera Bread because I had to get to the hospital for my appointment. So I get to the hospital. I have my appointment. My doctor takes one look at me and says, "I'm admitting you." Yeah, that's what I wanted to hear. I'm admitting you. Right. So I am admitted to the hospital, but the bed's not ready. So I had to go to the ER and wait there, where they took blood cultures, stool cultures, everything cultures. And it came back again that I was once again septic. I had salmonella again. I didn't go anywhere between the time that I had it last time and this time. So the other hospital, they didn't clear it up. Or because I was so immune suppressed, I just couldn't fight it off, which is what we figured out. Anyway, they also took blood cultures, and it found out that I was once again septic. I had this weird bacteria. I can't even pronounce it. It starts with an A and ends with dendriticus. The only way to get it is through soil or water. I was so upset. Again, I was in the hospital, this time for 2 weeks. I had 2 weeks of antibiotics, 2 weeks of surgery. I had a colonoscopy. They did a treatment called IVIG, intravenous immunoglobulin, because one test that they did, which looks at your IgG, IgGA, and IgGM, they were all about 0. They were way beyond normal. I had no immune system. They explained that the reason for this was because I was on so many immunosuppressants. My body didn't have a chance to fight back. So we had to do this medication in order to regain any immunity that I lost. So I fought. And I fought. The IgG gave me horrible migraines. For 2 days, I did nothing but lay down, lean over the bed, and throw up into a bucket. I was so sick. So finally, they did send me home. They felt confident that they could send me home. So they did. And what happened was I felt good for a couple days. And I had a re-checkup with the doctors, with the gastroenterology department, as well as the infectious disease doctors. So I put on my big girl pants, wasn't feeling very good still, and took off to the hospital again. So what happens when I get there? I'm tachycardic. I was still having the diarrhea around 20 times a day. 20 times a day. I spent the whole day in the damn bathroom. Pardon my French. Anyway, so what we did was admitted me again. This time, all I had was salmonella. None of the other creepy things. But I was so sick. Once again, all I did was go to the bathroom. I didn't have any ports. I didn't have any lines. Everything was taken out from the last time I was in the hospital. So they did IVs over and over again. This is what happens when you are so immunosuppressed that your body can't fight back. You get sick and sicker and sick. If I hadn't gone to the hospital, I was told that it would have killed me. Not being able to fight off the germs is incredibly damaging. The pneumonia never cleared up. Today I found out that I have nodules in my lungs because of the pneumonia. It is incredibly scary. You do everything you can. You can take vitamin C, calcium, vitamin D, so that you absorb everything. But it's still incredibly hard to fight off any infections when you are immunocompromised. There's just no way to do it. The only way you can keep track is by watching your IgG levels and making sure that they don't drop. What you need to do then, if they do, is get emergency IVIG therapy. They can do it through IV, or they can do it subcutaneous. For me right now, with my disease, Neuromyelitis optica, I am unable to get any of the preventative treatments that are required for my disease. I can't get Rituxan, I can't get Imuran, can't get Cellcept, methotrexate. None of those medications I can take because they are immunosuppressants. I am virtually unprotected right now. What does that mean? I could have an attack at any moment, at any place. I could have an attack on my brainstem, which could kill me or leave me on a ventilator. I'm kind of afraid because I pulled up documents telling my family to let me go if anything like that happens. But I don't want anything like that to happen to me. And if it does, it's because I've been so immunosuppressed. And I hope people realize just how damaging these medications are. And I just want to make the point across that you have to be very vigilant. Make sure your doctors are doing regular blood work. Sure, mine were doing the regular CBCs, but it was explained to me because I was on Imuran that those levels might always be in the normal range because they don't show up accurately. So, unless they do blood cultures, you don't know if anything's growing. What's the use of even doing the blood work half the time? It's scary. And for those of you that are in my shoes, I really feel for you because it is terrifying. Absolutely terrifying. And I question where I'm going to go from here because the treatment that I can get, which is the IVIG, which would help my immune system, but also hopefully keep me from having any flares of my disease. My insurance denied. Twice. so I can't get it, which means, again, I am virtually unprotected. All I can do is pray to every god out there that I don't have a flare of any form, because I don't want to be paralyzed. I don't want to be blind. And I don't want to be a vegetable. I don't want to be on a ventilator. I don't want anything like that. So I am going to keep fighting. I call my insurance company a couple times a day asking them what the status is. This is what I do. As patients, this is what we have to do. And I hope that none of you ever have to go through this, but I hope that my story gives you strength to fight. I want you to keep fighting. There's a song out there Sarah Platten sings. This is my fight song. When I'm gearing up for a fight with my insurance company, I play that song to get myself in the mood, to help me, fight back. Because they don't always have the patient's best interests at heart. It's about the money. It always is. It's not about us. And we need it about us. It shouldn't be how much that medication costs. It should be whether or not it works for us. And I'm really hoping that this video and you watching me and watching my story helps you in some way. Because I want you to be able to fight for you. You are your best advocate. And that is something that is very important to me. I want you to keep fighting because we need to keep fighting. These diseases, all of them, they're awful. And if we don't have someone to fight with us, there's no point. What do you fight for? Answer that to yourself. Get a piece of paper. Make a list of what you want in this life, what you want to fight for. You know what is at the top of my list? My niece and my nephew. My niece is 4. My nephew is 2. Well, 1. He's 1, sorry. So 1 and 4. I want to see both of them grow up. I want to see them graduate. I want to see them get married. I want to see their babies. I want to take my niece to Paris one day. Those are things that I want. What do you want? How are you going to make that happen? It's not going to happen if you're immunocompromised and septic all the time. I've realized that for myself. So I'm fighting tooth and nail. And I want you to do the same. Have a good day.